So what are rabies? So a quick overview first. Rabies is a virus that is transmitted from host to host via saliva, and rabies attacks or targets the central nervous system, or CNS for short, which is like the brain and spinal cord. So rabies is a very simple virus, as seen here on the right. It's just like a little bullet shape with the genetic material stored in the middle. And rabies are more commonly found in Africa and Asia than, say, America or Canada. So there are 5 stages when someone gets infected with rabies. Once you get bitten, you enter the incubation stage, and as seen here on the graph, incubation stage lasts for generally a very long time, 30 to 60 days. However, this can vary depending on the person, but most importantly can vary depending on where you're bit. So, for example, if this person was bit on the leg by a rabies infected animal, then rabies have to travel all the way up their leg and then travel up their spinal cord and then to the brain. Versus, say another person got bit on the shoulder, then rabies only have to just travel like this short distance to the brain. So depending on where you get bit, the incubation period can be longer or shorter. But even though the general time is 30 to 60 days, just be wary that there have been cases where the incubation period is as short as 4 days, while others, there have been recorded incubation periods of 2 years. After the incubation stage, we move on to the prodrome stage, or prodrome period, and this lasts about 2 to 10 days. And this is when like general symptoms appear, such as headaches, fever, fatigue, nausea, abdominal issues, such as abdominal pain or diarrhea, and anxiety, to list a few. And I say general symptoms because these symptoms can honestly apply to a whole range of diseases, but the one you want to, I guess, look out for to sort of verify if this rabies or not is a burning or prickling sensation at the bite. So after the prodrome stage, we reach the acute neurological period. And this is when the victims show signs of CNS or central nervous system dysfunction. And symptoms of this are hypersalivation, hyperventilation, and convulsions. So patients at this stage may also become very thirsty but will be unable to drink water. This happens if they try to, say, swallow water or you try to drink water during this stage. It might be very painful for them, or their body will just start convulsing when they try to drink water, which is why they, I guess, may develop a fear or avoidance of liquids once they reach this neurological period. Finally, afterwards, this lasts for about 2 to 7 days, and afterwards the patient will just fall into a coma, and then that most likely will lead to death. Rabies is one of the most deadly diseases in the world. This is because the death rate once an individual gets infected with rabies is 99%, which is the highest death rate of any disease on earth. The best way, however, to treat rabies is actually to take a vaccine once you're bitten. So this may seem a bit weird, taking a vaccine when you're already like ill, because usually when you think of vaccines, it's like you take it before to prevent the illness. But the reason why this works is because of the special incubation period, or I guess I should say the long incubation periods of rabies. So as mentioned before, incubation period in general is 30 to 60 days. And it's because of this long incubation period that you can take a vaccine after you're bitten, and that vaccine will still work because then your immune system will be able to recognize or respond to the vaccine, build up immunity, and by the time rabies is an active threat, so by the time it's like reaching your central nervous system, your body may already have built up the necessary defenses to push it back and eradicate it. On another note, vaccinating pets is also a very solid option just to prevent getting rabies in the first place, because you don't want, say, your pet dog or pet cat to get bitten, have them infected with rabies, and then they bite you, and then boom, now you're infected. And obviously, avoiding any wild animals is another solid option, as you're not sure if they're infected with rabies or not, so you don't want to risk it. So yeah, thank you for listening. If you have any questions, feel free to leave them in the comments below.